Assalamualaikum and good morning, good day to everybody. Today with us in Skin Diaries with Dr. Diana, we have Dr. Steve Chia. Doctor, thank you for your time today.
Thank you.
Okay, so a bit of introduction for Dr. Steve Chia. Dr. Steve Chia is a medical director and a founder of Sliq Clinic at KL Eco City and also Subang Jaya. And he is also a Galdima certified trainer for Sculptra and Restylane, and also international speaker for multiple aesthetic injectables. He is also experienced in biostimulators, HA fillers, and facial regenerative treatments. Okay, so let's go straight to the question number one, doctor. Okay, what is biostimulator injection treatment and why is it so popular nowadays?
Yeah, so now biostimulator is the trend, the main trend. So biostimulator are different from other injectables like fillers because like fillers, we just inject to give volume or plump up the face. But biostimulator is a new category or a different category of product. Wherever we do this injection, it's able to restore and make our skin younger over a period of time because it stimulates basically the collagen.
I see. Okay. So, what are some of the example of this biostimulator, doctor, and what is in them or inside?
Okay, in Malaysia, we have a lot of product that is category under biostimulator,
Okay.
but each of them has a different mechanical of action. So basically, the ingredient is totally different. So one of the most famous, or I would say one of the early dinosaur of biostimulator is Sculptra.
Yeah.
Okay, Sculptra is a PLA, polylactic acid. So we have other things like Estafil, which is PDLA. Also other thing that is famous like Radies, which is calcium based product. Also we have PCL based, which is Ilance, and now we even have hybrid products like Jewellook, which is PLA plus, also hyaluronic acid. Yeah.
Okay. So, how does it actually work? Sorry, and let's just talk about Sculptra.
Okay, Sculptra actually when injected under the skin, it will start to trigger immune response, where else your body will react to create new collagen when it reacts to this PLA. And because Sculptra needs our own body to respond to build the collagen over time, so we need to give it time to be able to see the results. Yeah, typically I would tell my patient at least give 4 to 6 months to see the improvement. Example, the fine lines and some of the firming over the skin.
Yeah, lifting.
Yes, and finally, of course, the lifting result, but that will probably need more than 1 or 2 sessions. Yeah.
Okay. So, can you explain a little bit the difference between biostimulator and HA fillers, hyaluronic acid fillers?
Okay, actually, hyaluronic acid fillers is bread and butter in aesthetic. We have a lot of patients that have been doing it over the years, but basically, it's just like the name suggests, they fill up the skin under the face. So it's commonly done over the laughing line, the cheek, and a common place also under the eye where we have sunkenness or the tear trough. And the other, for the younger patient, we do a lot for lips as well, making the lips a bit plumpier, chin longer, or even sometimes on the nose to make it higher.
So it gives an immediate effect.
Yes, fillers is very simple. You do the treatment today, you see the result immediately when you leave the clinic. It just plump up the area. But I think the main thing about fillers is it doesn't produce any collagen.
Collagen, yeah.
Yeah.
Okay, so let's talk about biostimulator again. Will it change the face shape or features, doctor?
Okay, mainly with biostimulator, the main target market or patient who will want treatment like Sculptra, basically they want something natural. They don't want a change in their face. But of course, with fillers, we can use it to change the shape, to contour, to make the nose higher, to give a plumpier lips. And that in some cases, we may change the features of the patients. But I do have a group of patients who basically they're happy and they always tell me I want to age more gracefully.
Yes.
Yeah. So these are the cases that they don't want. Yeah, they're suitable for collagen biostimulator.
Yes. Okay. Yes. So, and can you just give an example of the post-treatment care, the do and the don'ts, for example, Sculptra?
Okay. So biostimulator there are a lot. And if we specifically talking about Sculptra, which is my favorite, so it is actually patient needs to go back home and do a facial massage. The common rule that we use in our clinic is basically 5-5-5 rules, where patient have to massage their face for 5 minutes, 5 times a day for 5 days. Yeah.
So what is the reason for that?
Okay, because Sculptra, we use water, basically water as a carrier. So it comes in the dry powder form, but we need to mix it with a lot of water. And the water is actually will stay in the skin for 4 to 5 days. So when the water, before they fully absorb, we actually want it to distribute all over the face, so we get a very even result. Okay. Another reason is facial massage promotes blood flow and circulation to the treatment area. It will give us better results.
And then what are the don'ts?
Okay, as per usual for all treatments like injection, it is the same. There's no anything special with Sculptra. We will definitely avoid let's say alcohol, smoking, or even going to the sauna. Makeup for the first 2 to 3 days, and I think that's all. No any special kind of precaution with Sculptra.
Okay, so this is another question because maybe you have encountered it before. Why some patients see no results, and how do you decide on how many vials patient needs?
Okay, because collagen biostimulator, basically we need the waiting time. Okay, so or sometimes we call it like a Cinderella effect. That means immediately after injection they see the results because we mix with the water, right? But then Cinderella, yeah, and Cinderella is correct. Cinderella after 12 midnight turn back to the the mid version, right? And then the waiting time is the one that patient needs to be patient, right? So
this is something that patient needs to know.
Yeah, I think sometimes we explain to the patient, but patient is still impatient, right? Oh, there's no result. There's no result.
It's very excited.
Yeah, excited. And also another thing is sometimes I do see patients who say that they don't see much result. I think it's another category of patient is undertreated.
Undertreated. So I guess they need more sessions, more vials, right, doctor?
Yes, we usually go with a recommendation of the years in decades. That means 40 years old, they need 4 vials. 50 years old, they need 5 vials. Yeah. And they will typically only see the result, I would say 4 to 6 months after the treatment.
And the more that they wait, actually, the better that they will see the result, right?
Yeah, definitely. So for patients, right, initially after the first session, I would say there's no result after the first session. So they need to come back for the second sessions. And of course, there are a few things that patient can do to give better result because they have done research which just show that patients who have lack of sleep or patients who have unhealthy lifestyle like smoker, the patient will yield very little collagen because we need the body to respond to collagen. Another factor is extreme old age. If patient is older in age, they need more session because the ability to build collagen decreases with age.
Correct. Okay. Good explanation, doctor. What treatment can actually be combined with biostimulator, and when can you do it? Like, is it how many weeks after, and etc.
Okay. Typically with biostimulator, we will advise 6 months not doing any form of injection, especially on the same level of injection, which is under the skin. Of course, if you want to do your filler injection deep below, or you want to do any other treatment like even our therapy, HIFU that is deeper, is fine. You can do it anytime. Yeah, but on the same level, we do not want any product to disturb the sort of inflammatory process or a stimulation that we need to see the results.
So what are the treatments? Let's say if someone is watching today and they want to combine biostimulator with something to give more better results, or what are the treatments that can be combined with biostimulator in other sessions?
Okay. In my clinic, normally I will still recommend patient to do some dermal fillers because biostimulator like Sculptra, they are not used to create volume in very sunken face. So, typically patient have sunken temple, sunken mid face, and then say they want to do Sculptra. And typically this patient will be disappointed because
Because they need
yes, they need volume,
other
they need support, right? So I think you cannot run away with putting a little bit of fillers to give immediate support, and biosimilar will do the work to firm up, to tighten up the face, and they will give very natural results.
What about energy-based device?
Energy-based device, you need to see, like normally if those targeting smart layer, HIFU ultra P, you can do it usually even in a month time,
Okay.
right? Yeah.
Okay. Lastly, what is your advice if someone is considering the biostimulator right now, but still,
You're not sure about it. Okay, I think right, the main thing is you need to go to proper clinic first. This one is the emphasize the one, yeah.
Correct.
And you need to also convey and talk to your doctors. Let them know what exactly is your aesthetic goal. Some people want dramatic change.
Correct.
Some people, they just want to maintain subtle, or they just looking for a freshen look, right?
Correct.
Yeah. And the plan will be different, which we do first, which we will do second, right? So also choose basically products that is they done a lot of research. I think that's the main thing. Reliable brand.
Agree with you.
Definitely you will not go into any kind of problems with biostimulator.
Right.
Yeah. And if you're looking for something more natural and something that give you more long-lasting results, so biostimulator is the best product for you.
Choice of drink. Okay, so basically you must communicate with your doctor, communicate well on what you want to achieve, and choose the right clinic and the right product. Okay, so thank you so much, Dr. Steve. You made it. We have talked about it for so long.
Yeah.
Thank you for your time, and he is actually my neighbor, and I hope to see him again. Next topic, okay?
Thank you for your invitation. Thank you.